Hello everyone, welcome to Scalp Acupuncture 8, presented by Lamp AcuWellness Foundation Inc. Yin-Yang Scalp Acupuncture, or the Tang Scalp Acupuncture. Yin-Yang Scalp Acupuncture was invented by Dr. Song-Yan Tang of Shanghai, China in the 1960s. This system was developed based on the Zhangfu and meridian theory of traditional Chinese medicine. It is believed that the whole body can be mapped out on the forehead and scalp areas, and by using these images on the head, diseases throughout the entire body can be treated. This system is set up with a yin-yang point on the top of the head, and from that point, the human body is divided into two parts, anterior and posterior. The anterior part of the head belongs to yin, which reflects an image of a person lying in the face-up position. This area corresponds with the human body's face, upper jaw, middle jaw, and lower jaw, as well as the front part of the arms and the medial part of the legs. The posterior part of the head belongs to yang, which reflects an image of a person lying in the face-down position. This area corresponds with the human body's occipital area, neck, back, lateral part of the arms, and lateral part of the legs. This technique is more effective with multiple needles that are short and shallowly inserted with longer retention time. Standard points, lines, and aspects. In the figures, the filled circles are therapeutic points, and the open circles represent landmarks to identify different areas. Diametral orbit. This is the distance from the inner canthus to the outer canthus of the eye. It is used for measurement. Anterior-posterior midline is the line running across the vertex, connecting the midpoint between the two eyebrows with the lower border of the tip of the external occipital protuberance. Anterior-posterior side line. This line is located using the diametral orbit. It is one diametral orbit unit lateral to the anterior-posterior midline and runs parallel to the anterior-posterior midline. All the area locations between the anterior-posterior midline and the anterior-posterior side line use the diametral orbit as the unit of measurement. The distance from the anterior-posterior midline and the anterior-posterior side line is equal to one diametral orbit. Vertex ear tragus line. This is the line connecting the yin-yang point with the tragus. Outer canthus occiput line. This is the line connecting the outer canthus with the tip of the external occipital protuberance. The vertex ear tragus line divides this line into two parts. The line between the outer canthus and the vertex ear tragus line is called the canthus ear line. The line between the vertex ear tragus line and the external occipital protuberance is called the ear occipital line. Yin-Yang point. This is the midpoint of the anterior-posterior midline. Yin-Yang side point. This is the intersecting point of the anterior-posterior side line with the vertex ear tragus line. Yin-Tang side point. This is the intersection point between the line extending laterally from the Yin-Tang point with the anterior-posterior side line. Occiput side point. This is the intersection point between the anterior-posterior side line and the outer canthus occiput line. Yin-Yang aspect. These are the two areas separated by the vertex ear tragus line. The anterior aspect is the Yin area and the posterior aspect is the Yang area. Points, lines, and zones on the Yin aspect. Tian 2 point. This is the point 0.5 Sun directly above the midpoint of the anterior hairline. Tian 2 side point. Draw a line running along the side of the head, connecting the Tian 2 point with the lower border of the external occipital protuberance. The Tian 2 side point is located at the intersection of this line with the anterior-posterior side line. Tian 2 point, xiphoid process. This is the anterior 1/3 point on the line running from the Tian 2 point to the Yin-Yang point. Tian 2 side point. This is the anterior 1/3 point on the line running from the Tian 2 side point to the Yin-Yang side point. Chi point, umbilicus. This is the posterior 1/3 point on the line running from the Tian 2 point to the Yin-Yang point. Chi side point. This is the posterior 1/3 point on the line running from the Tian 2 side point to the Yin-Yang side point. Frontal face area. The frontal face area is the zone enclosed by the Yin-Tang point, the Yin-Tang side point, the Tian 2 side point, the Tian 2 point, and their connecting lines. This zone is divided into 5 equal portions and includes 10 areas. Use the diametral orbit as the reference of measurement. Vertex area number 1. At the 5th portion, 1/3 diametral orbit from the anterior posterior midline. Frontal area number 2. At the 4th portion, 1/4 diametral orbit from the anterior posterior midline. Temple area number 3. At the 4th portion, 1/2 diametral orbit from the anterior posterior midline. Eye area number 4. At the lower half of the 3rd portion, 1/4 diametral orbit from the anterior posterior midline. Ear area number 5. At the lower half of the 3rd portion, 1/2 diametral orbit from the anterior posterior midline. Nose area number 6. At the upper half of the 3rd portion, 1/6 diametral orbit from the anterior posterior midline. Mouth area number 7. At the lower half of the 2nd portion, 1/6 diametral orbit from the anterior posterior midline. Pharynx larynx area number 8. At the upper half of the 2nd portion, 1/6 diametral orbit from the anterior posterior midline. Face area, number 9. Lateral portion of the nose, mouth, and pharynx-larynx areas, 1/2 diametral orbit from the anterior posterior midline. Neck area, number 10. At the first portion, 1/3 diametral orbit from the anterior posterior midline. Upper jiao area. The upper jiao area is the zone enclosed by the Tian-tu point, the Tian-tu side point, the Xian-tu point, the Xian-tu side point, and their connecting lines. Heart area, number 12. At the middle 1/3 of the upper jiao area. Left, 1/4 diametral orbit from the anterior posterior midline. Right, 1/2 diametral orbit from the anterior posterior midline. Axillary area, number 13. At the middle 1/3 of the upper jiao area, 1/4 diametral orbit from the anterior posterior sideline. Lung trachea area, number 11. All of the upper jiao area except the heart and axillary area. Middle jiao area. The middle jiao area is the zone enclosed by the Jian-tu point, the Jian-tu side point, the Qi point, the Qi side point, and their connecting lines. Liver and gallbladder, number 14. The anterior 1/3 of the middle jiao area. Spleen and stomach, number 15. The posterior 2/3 of the middle jiao area, 1/2 diametral orbit from the anterior posterior midline. Lower jiao area. The lower jiao area is the zone enclosed by the Qi point, the Qi side point, the Yin-Yang point, the Yin-Yang side point, and their connecting lines. Urogenital area, number 16. Posterior 2/3 of the lower jiao area, 1/2 diametral orbit from the anterior posterior midline. In aspect of the arm. The in aspect of the arm is the zone enclosed by the Tian-tu side point, the posterior 1/3 point of the upper jiao area of the anterior posterior sideline, the anterior 1/3 point of the canthus ear line, the outer canthus, and their connecting lines. This zone is divided into 5 equal portions with 6 short lines from superior to inferior. In shoulder line, number 17. The first line. This is the portion on the anterior posterior side line. In elbow line, number 18. The third line between the second portion and the third portion. In wrist line, number 19. The fifth line between the fourth portion and the fifth portion. In palm finger line, number 20. The sixth line. This is the portion on the canthus ear line. In aspect of the leg. The in aspect of the leg is the zone enclosed by the anterior 1/4 point of the anterior posterior side line of the lower jiao portion, the Yin-Yang side point, the intersection point of the vertex ear tragus line with the outer canthus occipital line, and the posterior 1/3 point of the canthus ear line and their connecting lines. This zone is divided into 5 equal portions with 6 short lines from superior to inferior. In upper leg line number 21, the first line, this is the portion on the anterior posterior side line. In knee line number 22, the third line between the second portion and the third portion. In ankle line number 23, the fifth line between the fourth portion and the fifth portion. In toes line number 24, the sixth line on the canthus ear line. Triangular area. Measure from the outer canthus to the vertex ear tragus line. Then, based on this line, make an equal triangle. Connect the midpoint from each line to make 4 equal triangles. Upper triangle treats disorders of the teeth and face. Lower triangle treats mental and intelligence disorders. Anterior triangle treats disorders of the fingers and the palm of the hand. Posterior triangle treats disorders of the toes and the bottom of the feet. Points, line, and zones on the Yang aspect. Stomach spinal point. This point is on the anterior posterior midline at the anterior 1/3 point of the line running between the Yin-Yang point and the lower border of the external occipital protuberance. Stomach spinal side point. This point is on the anterior posterior side line at the anterior 1/3 point of the line running between the Yin-Yang side point and the occipital side point. Da Zhui point. This point is on the anterior posterior midline at the posterior 1/3 point of the line running between the Yin-Yang point and the lower border of the external occipital protuberance. Da Zhui side point. This is the point on the anterior posterior side line at the posterior 1/3 point of the line running between the Yin-Yang side point and the occipital side point. Yangguan point. This point is on the anterior posterior midline at the midpoint of the line running between the Yin-Yang point and the stomach spinal point. Yangguan side point. This point is on the anterior posterior side line at the midpoint of the line running between the Yin-Yang side point and the stomach spinal side point. Gaoxia point. This point is on the anterior posterior midline at the midpoint of the line running between the stomach spinal point and the Da Zhui point. Occipital neck area. The occipital neck area is the zone enclosed by the lower border of the external occipital protuberance, the occipital side point, the Da Zhui point, the Da Zhui side point, and their connecting lines. This zone is divided into 3 equal portions, including 5 areas. Posterior vertex area, number 25. At the lower 1/3 portion, 1/3 diametral orbit from the anterior posterior midline. Qingming area, number 26. At the lower 2/3 area of the middle 1/3 portion, 1/4 diametral orbit from the anterior posterior midline. Occipital area, number 27. At the lower 2/3 area of the middle 1/3 portion, 1/2 diametral orbit from the anterior posterior midline. Speech intelligence area, number 28. At the upper 1/3 area of the middle 1/3 portion, 1/2 diametral orbit from the anterior posterior midline. Back of neck area, number 29. At the upper 1/3 portion, 1/3 diametral orbit from the anterior posterior midline. Back area. The back area is the zone enclosed by the Da-Zui point, the Da-Zui side point, the stomach spinal point, the stomach spinal side point, and their connecting lines. This zone is indicated to treat thoracic vertebra 1 through 12. Lumbar sacral area. The lumbar sacral area is the zone enclosed by the stomach spinal point, the stomach spinal side point, the Yin-Yang point, the Yin-Yang side point, and their connecting lines, including two portions. Lumbar area, number 30. This area is the posterior 1/2 portion of the lumbar sacral area. Sacral area, number 31. This area is the anterior 1/2 portion of the lumbar sacral area. Yang aspect of the arm. The yang aspect of the arm is the zone enclosed by the anterior 1/4 point of the back area. On the anterior posterior side line, the Da-Zui side point, the posterior 1/3 point of the ear occipital line, the 1/2 point of the ear occipital line, and their connecting areas. This zone is divided into 5 equal portions and 6 short lines from superior to inferior. Yang shoulder line, number 32. The first line. This is the portion on the anterior posterior side line. Yang elbow line, number 33. The third line between the second and third portions. Yang wrist line, number 34. The fifth line between the fourth and fifth portions. Back of the hand finger line, number 35. The sixth line. This is the portion on the ear occipital line. Yang aspect of the leg. The yang aspect of the leg is the zone enclosed by the Yin-Yang side point, the Yang Quan side point, the anterior 1/3 point of the ear occipital line, the intersection point of the vertex ear tragus line with the outer canthus occipital line and their connecting lines. This zone is divided into 5 equal portions and 6 short lines from superior to inferior. Yang upper leg, number 36. At the first line on the anterior posterior side line of this area. Yang knee line, number 37, on the third line between the second and third portions. Yang ankle line, number 38, on the fifth line between the fourth and fifth portions. Back of feet toes line, number 39, on the sixth line on the ear occipital line of this area. Qianting area. This is the area located at the lower 2/5 of the yang aspect of the leg area. This area's function is to improve balance. Quiet line, wind line, and blood line. Divide the ear occipital line into 4 equal portions and extend the 3 dividing points upward to the level of the speech intelligence area parallel to the vertex ear tragus line. Quiet line, number 40. Anterior dividing point extension line that functions to calm the xian. Wind line, number 41. Middle dividing point extension line that functions to expel wind and release the exterior. Blood line, number 42. Posterior dividing point extension line that functions to invigorate blood. Thank you very much for your attention and hope to see you on our next video.